Healthcare is front and center at the heart of the debate over the government shutdown. So how are Americans feeling about the state of their medical coverage? How do you feel about it? Scripps News political director Andrew Rafferty joins us now. He's live with me in studio. And Andrew, how are Americans feeling? That question, how do they feel about all of this that's happening on Capitol Hill, and specifically with regards to health care?
Yeah, well, it's interesting. You have this stuff going on Capitol Hill parallel to what is going on for many Americans who are weighing their health care options come next year. Nate mentioned that open enrollment begins for many people on November 1st. And it is a time when a number of analysis show that we can expect that our healthcare premiums are going to go up, and the cost that we pay for our healthcare plans, whether it's through those Affordable Care Act exchanges or if it's healthcare you get through your employer, could also go up quite substantially come 2026. Now, these are normally filled with a lot of jargon. Sometimes it feels like these plans are intentionally written as complicated as possible to make it as confusing as possible. But there is one thing that is very clear, and that is that Americans have an extreme amount of anxiety over the cost of health care going into the future. We can look at these poll numbers from the Associated Press, and you see nearly 6 in 10 Americans, 57%, are concerned over the rising cost of health care. Very concerned, extremely concerned. Those were the two options. And then among some of the more potentially dire consequences, the numbers aren't quite that high, but still significant. If you look at this, concern over losing or not having health insurance, nearly 4 in 10 Americans say they are very concerned about that. And when it comes to being unable to actually pay for the medications, you need similar numbers, 42%. And so it's not a surprise that this is messaging that is so important to Democrats. Not a surprise that it is so important, not only because of the shutdown and those subsidies that we know are expiring at the end of this year, but also as Americans, we expect, both according to independent analysis and also some of the Affordable Care exchange rates that have been made available. Not every state has made theirs available quite yet, but we have seen in dozens of states that the cost is simply going up. And so that all figures into this calculus that we've seen from Democrats on Capitol Hill. Yes, Republicans say this is politics, that these are two separate issues, funding the government and these subsidies, but there are real policy implications for Americans who are very worried about how they're going to afford health insurance next year.
Raph, is this the perfect storm politically or imperfect, depending on how you look at it? Because we're both ends of the scale. I'm a baby boomer, and I'm looking now at rising health care costs with regards to end-of-life care, so to speak. You now just had your first child.
That's right.
So if you think about it, I remember when I was a little younger, I didn't really pay that much attention to health care.
Yeah.
After my first child, I did. And we're both ends of the spectrum, but both of us are watching our health care costs.
Yeah, absolutely. And I think that what we saw in 2018, in the midterms during Trump's first stint in office, is Democrats really captured lightning in the bottle. I don't know if it was exactly the same, but the heart of it was, well, we want to repeal the Affordable Care Act, Obamacare. We don't really have a plan to put in place, but Democrats capitalized on it. Republicans, you don't hear talking about repealing Obamacare as maybe vociferously, as vocally as they did in Trump's first term. Certainly, if you ask them in front of a camera, they say yes, but they don't get into too many of the specifics. But the bottom line here, and this is another interesting point in this poll, Del, is yes, we think about last year when the economy was so dominant at the heart of the campaign, and it still is the top issue, but healthcare is rising. It is right behind it. And part of it is because, yes, is sort of everything coming together here in the fall going into the end of the year. And then another thing, I think, is what you noted, where there are healthcare is such a broad topic, and the cost across the board, whether it's having a new kid, caring for aging parents, the cost seems to be going up on all aspects of it. And it really is becoming untenable for a lot of Americans.
I have a 94-year-old mother-in-law living with us, too. So you talk about the sandwich generation. We represent all of the spectrum. Our political director, Andrew Rafferty. Raph, as always, thank you.